Yeah, I mean, so I grew up in Canada, and
Hmm.
one of the first things that was very apparent, like very oddly apparent when you move to the States, is everything is an ad for pharma. It's crazy. Like it's just you don't realize it when you're here, but you do
Yeah.
realize it anywhere else. Where like you just don't see it anywhere else, and here it's like every other ad, maybe every like 3 out of 4 ads are something for pharma, some new product. Ask your doctor, and I am not a fan of that because I'm not against advertising, but the problem is because pharma is so big and because there's so much of the ad spending, they kind of own everything,
Hmm.
and they're such a important part of all these platforms and the news and all these other modalities that you basically have them funding those platforms, and then it's really hard to question anything on them. It's really easy, if a newscaster is like, oh, let's do a report on this thing, then the farmer's like, no, 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 don't do that. Like, that person's gone if they're asking questions. So I think it's a big problem because you're getting um, them to kind of fund everything, and so we just don't realize how much of an influence they actually have over the news and media and the medical journals and
Hmm.
medical schools and everything. So that's where I think the problem is, not so much the actual ad, as it is that they kind of are behind the scenes and the partner of,
Wow.
of every kind of
I never
uh,
thought about that. How
modality.
much money they're putting into just media in general, aside from just the ads too. Wow.
Right. So
Hmm.
I think it's much less, and multiple people have said this now, that it's much less about them trying to promote their drug and making you think. Obviously, like any ad, it's like, you think about it, you might want to go get it, but mostly it's more so that they can buy the platform. Like they kind of own it because they're funding it, and if you say something bad about them, then they could pull their funding. So you're much more hesitant to say something
Wow.
bad about their company on the news, I think.
Wow. I'm a bit mind blown right now. Okay, just a quick thing about the weight loss drugs. Are they miracle drugs that help people lose weight, and are we gonna have shots that help us build muscles? And is it like actually like a beautiful thing that people can get healthy with weight loss drugs, or is it still like not safe for people?
I mean, it's interesting because they do seem to work really well for weight
Hmm.
loss. So I think that they have a place, and most medicines have a place. I'm not against medications. I just think it should be a last resort in general, and you use things when you need to. And these drugs, they do seem to be helpful, but it's something you need to take, basically forever. And
Hmm.
everything, nothing is that magical, right? Everything has a cost to it, and the more long term data that we're having, the more problems that we're starting to see. And so I think that there are some major risks. Certainly, we've seen eye issues and liver issues and
Yeah.
gastrointestinal issues. So they come with their risks, and obviously everyone's different. So it's not necessarily going to be a huge issue or side effect for you. But you can't just willy nilly take a shot every day and not assume it's not going to have some implications. So I think that we're at a place where we're using a medication to solve a problem that we're not solving the problem for why it's there in the first place. So we have this obesity epidemic, we have a food problem, we have an exercise problem, and then we're just saying, take a shot and that'll cure all your issues, but it doesn't get to the underlying issues that you're having or the system in general. So does it have a place?
Mm.
Yeah, I do think it has a place. I think for somebody who's morbidly obese, very ill, not able to get in a positive direction, then it could be something that might help you in the short term to get you going in a better direction, to be like, all right, let's get some wins, let's decrease the amount that you're eating, and then maybe you start feeling a little better so you can exercise a little bit more and you eat a little bit healthier. And to me, if you're for somebody who's very very severely ill or very morbidly obese, has lots of complications, is getting near to death basically, or very serious, then maybe that's the thing that can push you back in a better direction and get the
Hmm.
ball rolling. But it can't be in isolation. I think you have to have the plan that you're going to use this for a few months or a year or whatever it is, and work towards getting better habits, and maybe that could be the thing that helps you get there. So that to me is the scenario where I could see it being very useful, versus the person who just wants to lose a couple of pounds, or the teen who's overweight,
Hmm.
who is just eating a bunch of crap and doesn't want to do the work. Like that to me isn't solving the problems. It might move you in a better